Hi guys, it's Dr. Katie from Sports Performance Physical Therapy, and I'm here with this week's question of the week. The question this week is, what position should I sleep in if I'm having back pain? The answer to that is a little bit nuanced. It depends on what kind of back pain you're having, more specifically, which positions you already prefer. If you know that your back pain hurts more when you lean back, it seems pretty intuitive that we wouldn't expect you to lay on your stomach because that puts you in a more extended position, just like it would be if you were standing and you leaned back. So if you have pain with extension, that backwards lean, my recommendation is that you find a bolster like this, or even just a regular pillow that you have laying around your house. And you're going to use that to actually put your body into a little bit of relative flexion. So I'm putting my hips in a slightly bent position, and my back is really going to have a hard time extending from here. What I'm trying to do is create a neutral spine at this position and take the pressure off of my back. Now, if you know that you have a back pain that does not prefer flexion, meaning bending forward, then I would say you may be someone who would benefit more from laying on your stomach. At the very least, you may want to lay on your side. For a lot of people with general low back pain that doesn't seem to have a positional preference, laying on your side is also a comfortable position. So for both flexion and general low back pain that does not have a directional preference, my recommendation is to take, again, a pillow or some kind of bolster and to put it between your knees when laying on your side. If you don't like being in a flexed position, you would keep your hips straight, and if you don't have a preference, you can go straight or bent. Either one is fine. This tends to be a really comfortable position because it takes the pressure off of your hips, makes you a little bit more comfortable and relaxed through your abdomen, and it also puts your neck in a more comfortable position if you like that. There's also stomach sleeping. Some people prefer to have one hip hiked up. One position that I like is to kind of lay 3/4 turn from being completely flat on your stomach. And what that would look like is on your stomach, partly sideways. And so I'm not fully flat, but I'm also not fully on my side. I'm right in between. And that can be pretty comfortable, especially if one leg or one hip is more affected than the other. You can prop up or give yourself a little bit more of a support on the side that's bothering you. Now, as far as low back pain that is not relieved by any of those positions, some of my clients prefer to use a much larger block of pillows under their knees to put them in more of a 90-degree position. That takes a little bit more setup, but if you stack some pillows and you create almost like a shelf, that can take the pressure off your back as well. It's a more extreme version of laying on your back with the pillow underneath your knee. If there's anything else that you're not sure of, please be sure to ask your massage therapist or your physical therapist at your next visit, because they can give you a little bit more specific answers as to what's ailing you. My name is Dr. Katie, and this is the question of the week at Sports Performance. If you have any questions, please feel free to call us and reach out, get scheduled for an appointment. You can also like us on Facebook and follow us on Instagram.